Hi, and welcome to Hope with Answers. Today I'm here with Dr. Christine Lovely.
Hi, call me Christine.
Thanks so much. I'm Lisa Goldman.
Lisa.
I'm a patient advocate, and today we're here to talk in a little more detail about targeted therapies. Specifically, I'd like to know a little bit more about a targeted therapy I've heard of called TKIs. Can you tell me what a TKI is?
Sure. A TKI stands for tyrosine kinase inhibitor. You know, everything in medicine has a complicated name. TKI is actually a pill that can target cancer. So this is amazing if you think about it. A pill that you take just by mouth that can actually attack cancer cells. And there are many, many different types of TKIs, just like there are many, many brands of ketchup or salad dressing. There's lots of different kinds of TKIs that target different parts of the cancer.
Mm-hmm. So you said it's a pill. Is this a pill that, so I don't have to go into an infusion lab like I did with chemotherapy?
Absolutely.
I just take the pill, and is it something I pick up at my corner CVS, or how does it work?
Yeah, so TKIs are pills that you just take by mouth. They can be once a day, they can be twice a day. There's many of them, there's hundreds, so it's a little bit different depending on which medicine you take. Some of them you actually can get at CVS, which if you think about it is actually amazing that you can get a cancer drug at CVS or your local grocery store. Not all of them, but a lot of them you can. And the side effects of the TKIs can be very different depending on what specific drug a patient is taking.
I was actually wondering about that. Are they easier to tolerate than chemotherapy?
Yes. So I think in general, these are drugs which, first, if you think about just the quality of life of not having to sit in an infusion room for 6, 7, 8 hours, that's huge. These are pills that you can take at home, that you can take with your other medicines sometimes. Sometimes they have to be taken with food, sometimes they're taken without food. The side effects can be very different depending on what specific TKI a patient is taking. But in general, the side effects of TKIs are different from the side effects of traditional chemotherapy. They don't cause the same amount of risk for infection, they don't cause the same amount of lowering your blood counts, and so they are very different than what we usually think about for chemotherapy.
And a lot of patients I know have lung cancer that's spread to their brain. Can they use TKIs for treatment of their brain mets?
That's a great question. And so all of these drugs, if you think about it, they have to go to everywhere in our body to really fight the cancer, because the cancer can be in your lungs, the cancer can be in your bones, the cancer can be in your brains. Just like there are hundreds of TKIs, each TKI's ability to get to the brain is a little bit different. Our brain is a very special and privileged site in our body. And so the ability of medicines like TKIs to get there is not always the same as the ability of the medicines to see the tumor in the rest of the body. That's definitely something you should talk to your doctor about when you're undergoing treatment, is does this medicine get to the brain?
Can a patient take a TKI for, how long does a patient take a TKI for? I guess I should ask, is it like a chemotherapy where it's just a period of months or years?
Yes. So I think in our ideal world, we would love for patients to take TKIs forever. That would be the best case, because that means that the TKI is controlling their tumor, and that's our goal. It's everyone's goal here. It varies depending on what TKI you're taking and what the side effects are, but in general, I'd say that these TKIs, most patients will take them for a year, maybe a couple years, and then oftentimes we can actually switch to another TKI, which again, if you think about it, it's pretty amazing that serial pills to treat cancer.
All right, I just have one more quick question that I know patients have come to me and asked. Are TKIs only for stage 4 patients, or can earlier stage patients talk to their doctors about TKIs?
Yeah, that's another great question. So right now, the way we use TKIs is mostly for patients who have stage 4 cancer or cancer that's spread to other parts of the body. But there are lots of ongoing studies in lung cancer to try to understand, can we use TKIs earlier? Because really what we want to do is try to find the cancer sooner and treat it as fast as we can and as aggressive as we can. In breast cancer, for example, they use TKIs earlier, and I think we're going to learn a lot from the breast cancer field about how to use these very effective medicines sooner on in a patient's disease course.
Well, thank you so much for this great information. Thanks for joining us for Hope with Answers.
Thank you.